All right, everyone. Again, I'm Mr. Peterson, and my presentation is going to be about ADS-only CPR with an AED. Everyone know what CPR stands for? Cardiopulmonary resuscitation. Do you know what an AED stands for? Very good. You can read. I like that. Anyway, I first learned CPR when I was a lifeguard in the late 1970s, but things have changed a lot. So, we're going to see what they've changed too. Okay, let's go to the presentation. I found this video. It's a very nice one. It's done by the Spokane Fire Department. And they're going to show what we do now.
That happens all too frequently in this country.
Star player Wes Leonard collapsed on the court just moments after making the game-winning basket.
It will be at least a week before we know exactly what caused the sudden death of Hank Gathers.
This time it was 16-year-old Robert Garza. It happens roughly 75 times a year in the United States alone.
A student collapses and dies on the court or field. When a tragedy like this happens, people often think there's nothing they can do. But there is. Immediate treatment before paramedics arrive with cardiopulmonary resuscitation, or CPR, and an automated external defibrillator, or AED, gives the victim the best chance at life. Sudden cardiac arrest can strike anyone at any age, at any time.
I was playing basketball in the gym and I just collapsed. I had no idea that I was at any risk and suffered a cardiac arrest. And luckily, thankfully, CPR was started right away, and I'm here today because of that. I ran out here and Tori was on the ground, and I just called 911 immediately.
Carrie Conker helped save Tori's life by starting CPR.
It took me a long time to come to terms with what I did. I still haven't completely. It's still a complete shock that this happened. Tori's such an amazing person, and not someone I would ever peg as someone who would have cardiac arrest, and not someone I would ever, you know, I wouldn't see her walking up the street and go, she's going to have cardiac arrest. I never thought that CPR would have to be used on me, and it saved my life. And I mean, I'm so grateful for that.
Tori was one of the lucky ones. It is estimated that more than 95% of sudden cardiac arrest victims die before reaching a hospital, resulting in approximately 250,000 deaths each year in the U.S. Only 1 in 4 patients in cardiac arrest receives bystander CPR. If CPR is performed, you can double or triple a person's chance of survival. Based upon the overwhelming support for early bystander and community involvement, the American Heart Association has revised their CPR guidelines to include hands-only CPR as the preferred method of resuscitation for the untrained bystander. In addition, there is an emphasis in the community to increase AED availability to ensure the likelihood of early defibrillation.
If you look at the curves that have been established for people's survival in this setting, what you find is only about 10% of the people will survive if they get shocked at 8 minutes. But if good chest compressions are started right away when the person goes down, you can alter that death curve, if you will, significantly, such that people will respond to electricity for quite a bit longer. And in fact, at 8 minutes, if CPR is started immediately, at 8 minutes, we have more like a 40 to 50% chance of saving someone's life.
Over the next 2 class periods, we will train you to become effective responders in the case of sudden cardiac arrest. You will be able to identify when to start chest compressions and how to perform them to ensure that they are high quality. You will be trained to use an AED and where to find the AED in your school. Finally, we will practice both CPR and AED use to ensure that any victims have the best chances for survival. Simply stated, cardiac arrest is when the heart is no longer pumping blood through the body. The victim is unconscious, not breathing, and has no pulse. If not immediately treated, the victim will most probably die. Cardiac arrest and heart attack are not the same thing. A heart attack can cause a cardiac arrest, but there are other causes. What you need to remember is, regardless of what caused the cardiac arrest, good skills and rapid treatment are the keys to survival. Remember that every second counts for victims of cardiac arrest, and at 10 minutes after collapse, they have a minimal chance of surviving. So do whatever you can do as fast as you can do it. The American Heart Association has simplified this urgency into the chain of survival. 1. Early access. Call 911. 2. Early CPR. Start chest compressions. 3. Early defibrillation. Use an AED. 4. Early advanced care. Paramedics. In most cases, paramedics can't respond and arrive at the patient's side quickly enough for the patient's sake. Now that AEDs are available to non-medically trained people, you can become a vital link in this chain of survival. New guidelines from the American Heart Association recommend hands-only or compression-only CPR for non-medically trained individuals. Fortunately, these recommendations make CPR much easier to perform and dramatically increase the likelihood of a response from bystanders.
It has significant benefits in a lot of ways. First of all, it's a much easier way to do CPRs. It's not that difficult to learn how to do it. You don't have to try to coordinate breaths and chest compressions, etc. The other thing is that large studies have been done that show that what causes people to be reticent about doing a resuscitation on a neighbor or loved one or someone who just goes down in the public is that folks are afraid of communicable diseases. They don't want to have to do mouth-to-mouth resuscitation.
This new guideline is recommended only for adults in cardiac arrest. It is not intended as the primary response for children or victims of drowning. When adding breaths to chest compressions is still recommended, although it is accepted that any effort is better than no effort.
Everybody okay?
If you witness someone collapse, immediately call 911 or direct someone else to activate the emergency response system by calling 911. Shake the person or rub their chest hard to get a response. If you do not get a response, start CPR immediately. Do not wait to check for a pulse. Position the patient with their back on the floor or ground. Place the heel of one hand over the center of their chest over the breastbone and place your second hand with fingers interlocked over the first. With your elbows locked, apply a downward force by falling into the patient so that the motion is directed from your torso and not your arms. High-quality CPR consists of 4 critical variables: depth of 2 inches, rate of 100, full recoil of the chest, minimal interruption. Most individuals can only perform high-quality CPR for 2 minutes before fatigue sets in. To ensure that your victim receives only high-quality CPR, you should switch providers every 2 minutes. Remember to coordinate the switch so that there is minimal interruption or no pause at all. The reason why these criteria are important is to ensure the forward progression of blood flow to the brain. By pressing 2 inches deep, we ensure that the heart pumps blood effectively. Full recoil ensures that the heart fills completely for the next effective compression. Studies show that a rate of 100 compressions per minute is ideal to ensure forward flow of blood to the brain.
It's difficult for some people to remember 100 per minute and figure out what that is, unless they have a metronome. So what I usually say is, sing the song by the Bee Gees. You know, dun, 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 staying alive, staying alive. If you sing it at the rate that they sing it, then that pretty much will pace you at 100.
It takes several compressions to get forward progress of blood to the brain, so any pause effectively becomes a loss of momentum and therefore makes subsequent compressions less effective. Remember, you can only help someone by performing CPR. Do not worry about breaking ribs or harming the victim of cardiac arrest. Studies confirm that minimal harm is incurred by individuals that require chest compressions, and the benefits of CPR are life-saving and worth the risk.
But at the very worst, you might break a rib or two. But on the other hand, if you save their life, they're going to be grateful for a broken rib.
The goal of high-quality CPR is to improve the patient's response to defibrillation or electric shock and maintain blood supply to the brain. CPR does not restart the heart, but will improve the likelihood of the heart responding to an electrical shock, which will help the heart start beating again. Remember that high-quality CPR directly improves an individual's potential response to a shock. If that shock is provided within 10 minutes of collapse, and high-quality CPR is started immediately, the individual's potential survival rate is dramatically increased. Without both of these interventions, the death rate is nearly 100%, so act quickly and activate the 911 systems immediately. Remember the 4 components of high-quality CPR. Depth 2 inches, rate of 100 compressions per minute, full recoil, and minimal interruptions.
All right. Just stop that, go back to the presentation. All right. Next one, please. Now this is a pretty good deal. I mean, when I was trained to do this, there was a lot, you're right, you had to coordinate the breaths, you had to do the chest compressions and all that stuff. It was difficult to remember, so the simplification is really great. But let's just review a few things here. They're talking about cardiac arrest here, That means that your heart is stopped. It's the same thing with a heart attack, but a heart attack usually means the blood flow has been interrupted to the heart, and that's why it stops. That's why they differentiated the two. But basically, the person laying on the ground unconscious, you may actually see them fall down. They may not be breathing, the breathing is irregular, and they don't have a pulse. But they really don't want you to even take the time to do that because, as they mentioned several times, it's important to get going as soon as you can. You can see here, we talk about the chance of survival decreases by 10% each minute without the use of defibrillation. So here they're showing you the time it takes typically for an ambulance to arrive, 9 minutes. It's too late by then. But if you start working in here, and something is better than nothing. So, the idea is that you learn as much as you can because AEDs are everywhere. There's one right outside the door there. Did everyone ever see that? It's right by the gym. That's typically, it's there because as you saw some of the examples there was a student athlete that just collapsed. Next, please.
Can we turn the lights back on? Sure.
Okay, they mentioned good skills and rapid treatment are keys to survival. Because after 10 minutes, cardiac arrest victims have a minimal chance of survival. So do as much as you can, as fast as you can. You mentioned several times that it's hard to cause really additional damage. I mean, the person is almost dead as it is, so you might as well try. And the thing about it is, a lot of times when these things happen, everyone's standing around watching because nobody knows what to do. Here, at least you can have an idea of what to do, but you need to take control. Because you need to start out by getting some people to call 911. And the thing is, you don't just get one person to do it. If you can get 2, that's even better. Because one person makes a call while the other person listens to them. And they may say, well, wait, that's not the right room. It's somewhere else. So if someone goes off and you point some people, you 2, call 911. And then you want to start on your compressions. And while you're doing that, you get some other people and you tell them to go look for an AED. You may have to get a bunch of people because they may not know where it is. So you can send out as many people as you can to get that. And you use that as soon as you can. And of course, the last part of this chain, the chain of survival, is that you get advanced care by paramedics, which you've ensured by calling them right away. Next, please. Now, if you witness someone collapse, first thing you do is either you call 911, you don't do anything until someone's done that, or you better, if you have people around, you assign them the caller. 2 people at least, it really helps. And then you shake the person, and you try to see if they're really unconscious, if they're not having cardiac arrest, they're gonna revive, and they may be a little dazed or something, but that means that their heart is still beating.
John?
Yeah.
There are two methods that I know of that you can try to reawaken an unresponsive patient. One is to take your knuckle and them right in the chest, called the sternal rub. The other one is to grab a piece of skin and pinch it. So up there, if you go rub the patient hard and try pinching some of their skin and they get no response, carry on.
Yeah, because it hurts.
They better respond.
Yeah, and they'll respond if it hurts. So if they respond, great. Not much more you have to do. You still needed to call 911, but that's already been done. But if they don't, you need to start CPR immediately. Don't even bother to check for a pulse. And try to get them to see if they'll revive when they have it. And that can be a tricky thing too. You may spend precious time trying to, well, okay, where is it? Where's the carotid artery? Do I feel, is anything there? Oh, geez, I don't know, You wasted time. But you position the patient on hard ground. If you're on a bunch of marshmallows, you can't really do compressions, can you? So they want to be on the ground or something where when you compress, it isn't gonna be moving down. And then, does everyone know where the breastbone is? Can you feel the bottom of your ribs? Your ribs come together. The ribs are bone. They come together in the breastbone, which is cartilage. So that's why it can move a little bit. There's a little flex there. If you push below that, that's not going to compress the heart, is it? That's where you do the Heimlich maneuver. Remember that? Push upward. That's under the ribs. This is on top of the ribs, right there. So you kind of have to feel where it is. You put the heel of your hand on there. Then you interlace the other ones, and you keep your arms locked. And as it says there, you use your torso to apply weight on them. 2 inches. Does that seem too slow or too fast? A little slow. How's that? Better. Okay? Next, please. Now, they mentioned the keys to high quality CPR here. Depth of 2 inches, rate of 100, full recoil of the chest. You know what that means? Full recoil, what they're talking about there. That means you have to let up all the way. Because you need that 2 inches travel. You're pushing blood out, you're letting blood back in. So that's why you have to go down 2 inches and then back that same 2 inches. You don't have to lift off, but you just kind of get a feel for it. And if you remember in the video, they show that it's much more productive to keep the blood moving. There's still oxygen content in there, but if it stops, it's going to drop oxygen level in the brain. So you want to keep it moving. So that's why they talk about minimal interruption. You'll see later on when they put the electrodes on for an AED, that the person doing the compressions doesn't even stop for that. Those other people are working right around them because they don't want any interruption. Next, please. So, 2 inches of compression. Full recoil. Next. 100 beats per minute. And minimal interruptions. You want to keep that blood flowing to the brain. Next. Okay. Now, the things that's really changed is with technology. Better electronics, batteries, and everything like that. It used to be you did something called the precordial thumb back in the 70s. You ever see that in a movie where they did that? Pretty much worthless. It's been replaced with an AED, and an AED is a very smart thing, and we'll see. Let's play that.
Yesterday, we discussed the recognition of cardiac arrest and why early CPR and activation of the emergency response system is critical for survival. Remember to call 911 early or direct someone else to do so. Recall the 4 components of high-quality CPR: depth, recoil, rate, and minimal interruption. All of these increase the likelihood of a victim to receive and respond well to electrical defibrillation.
Shock attack. Don't touch patient press flashing shock button. Shock delivered. Start CPR.
We know from resuscitation science that the earlier a shock is delivered, the increased likelihood that it will restart the heart of a person with cardiac arrest. AEDs, or automated external defibrillators, are one way of ensuring that victims of cardiac arrest receive an electrical shock as soon as possible. Many public facilities, such as schools, malls, churches, airports, have AEDs available for public use. Your school has one or more AEDs available for use, and it is important that everyone be familiar with its location and know how to use it. In addition, it is important to notify the appropriate individuals if you notice that the AED has been tampered with or is missing. It is critical that the device operates and is available when it is needed. You already know how to perform high-quality CPR. After today, you will know how to pair that CPR training with the use of an AED. Each of you will have an opportunity to become familiar with an AED, how to apply the chest patches, and how to deliver a life-saving shock, all while performing high-quality CPR. This requires teamwork to maximize the resuscitation effort, but it can be done by a single individual as well. An automated external defibrillator, AED, is a smart machine designed to detect whether a cardiac arrest victim would benefit from a defibrillation shock and to instruct the operator to perform all facets of treating the victim until paramedics arrive. An AED is simple and safe to use.
The ultimate therapy for these patients is electricity. But what you do with good cardiopulmonary resuscitation, CPR, hands-only CPR specifically if you're a citizen responder, is you prolong that period of time during which a person's heart will be responsive to the electricity.
The heart